The number of COVID-19 cases is rising in Georgia, but tonight we're hearing from a Macon man who is recovered and on the mend. The 28-year-old attorney talked to Chelsea Bimefor about the painful symptoms and the hoops he had to jump through just to get tested. Chelsea joins us live now from her home to tell us what she found out.
Yeah, Frank, Jordan Josie says he just got his positive test result back yesterday, nearly 3 weeks after he says he was exposed to the virus. Today, he just has a lingering cough, but he says it started out much worse.
Shortness of breath, fever, cough.
Those are the symptoms that 28-year-old Jordan Josie woke up to on March 17th.
I went to the urgent care center asking for a test, and they said I didn't meet the criteria.
Since he hadn't traveled outside the country or come into known contact with a confirmed case of coronavirus, doctors sent him home with steroids, an inhaler, and no COVID-19 test.
My chest would hurt with every single breath, and if I coughed, it was like getting stabbed with a knife.
Josie says the symptoms intensified, so he returned to the urgent care 5 days later, and doctors discovered a partially collapsed lung. The next step was the emergency room, where healthcare workers told Josie he still couldn't get tested.
I was sick for 10 days total. I ran a fever for about 8. The worst of it was the way it attacked my lungs.
In the middle of what he calls a horrific journey, Josie and his wife learned they had been exposed to a confirmed case on March 13th. They called her physician, who finally agreed to test Jordan. By this time, his wife's symptoms had faded, so she was not swabbed.
I kind of had this feeling in my mind like this shouldn't be happening to me because I'm young and I'm okay. I think the only way we're going to stop this is if we take the guidelines seriously and we prevent the spread by everybody staying confined.
Now, Josie says his doctors tell him he is no longer contagious, but he will continue working from home like most of us over the next few weeks. He says luckily his law firm was already practicing social distancing and sanitizing before he fell ill, and thus far no one at his office has been feeling sick. Reporting live in Macon, Chelsea Bimefor, 13 WMAZ News.
Hi, thank you, Chelsea. The American Red Cross says people who have fully recovered from COVID-19 actually have antibodies in their plasma that attack the virus, which could be used as a potential treatment. Josie says he has applied to donate and is waiting on approval.